Do you pee a lot during the day? Or do you often get up at night to go to the bathroom? Be careful! It could be a sign that your body is asking for help. There are trivial reasons, and some very serious ones. Today, I'll not only tell you when you should actually worry and when you shouldn't, you'll also discover what no one ever told you about why you pee more, and how you could improve this naturally, without always depending on medication. So stay until the end, because I'm not only going to explain the main causes, but also, halfway through the video, I'll share a little-known exercise that could be a lifesaver for anyone who doesn't want to keep waking up tired. Ready to finally understand if peeing a lot is really bad? Or just an annoying curiosity? Hi, I'm Dr. Veller, a specialist in nephrology and kidney diseases. If you've ever asked yourself, why am I peeing so much? Could something serious be happening to me? Or simply, how can I keep my bladder from waking me up so many times at night? This video is for you. And listen, you're not alone. Did you know that about 30% of men and up to 40% of women will experience this problem at some point? Most of the time, it's nothing serious. But the trick is to differentiate between what's harmless and what's problematic. How? That's what we'll learn today. What counts as peeing too much? Let's go to basics. Normally, adults go to the bathroom between 5 and 7 times a day. At night, it's most common not to get up at all. But be aware that about 30% of adults might pee once during the night. And after age 70, up to twice per night can be normal. But what if you're going 8 or more times a day? Or have to get up more than once or twice at night, depending on your age? You need to pay attention. This could be an early warning sign of another problem. And what about the amount? Up to 3 liters per day is considered normal. But of course, this depends a lot on what you eat and drink. For example, for a person of 70 kilos, up to 2,800 milliliters. But if you go beyond these values, the medical word polyuria comes into play. You're urinating excessively. And warning, even if your values aren't that high, if either this frequency or amount disrupts your routine, interrupts your sleep, your outings, or makes you uncomfortable, that's a first warning sign. And you should always find out the underlying cause. Why? I'll explain that shortly. But first, something few people know. Many believe that if you pee a lot, the problem must be in your urinary tract, kidney or bladder. But actually, peeing is a process that involves many systems in the body. And sometimes the cause is far from the bladder. So what are the most common causes? We'll start with a fact you might not expect. The most frequent reason is simply that you drink too much liquid. If you drink more than 40 milliliters per kilo per day, or have a lot of water or beverages after 8 or 9 p.m., you probably already have the answer. That's simple. But it doesn't end there. There's something more interesting. It doesn't always depend on volume, but on the type of liquids. Are you a fan of coffee, yerba mate, tea, chocolate, or alcohol? All these drinks and foods have a diuretic effect. That is, they make you pee more. And if you eat a lot of leafy greens, asparagus, beets, or fruit, like watermelon and melon, those could also increase your trips to the bathroom. Stress and anxiety can also play a nasty trick on you. Being nervous or on alert can activate your bladder more than usual. Another strange cause? Constipation. If you haven't had a bowel movement for several days, pressure rises in the pelvis, and your bladder has less room to fill up. Result, you go more often. Fortunately, these things are usually resolved by adjusting your habits. Your health is not in danger. But sometimes it's not so simple. Now pay attention. When you can't explain it easily, you have to think about possible illnesses. Because peeing a lot can be the first clue to something more serious, from infections to cancer. Stay tuned because I'll soon tell you the clear warning signs. Let's differentiate. Do you urinate only a little each time, feel like you never finish, or have burning sensations? The first thought should be a urinary tract infection. Very common in women, less so in men. But it could also be kidney stones, gynecological problems, vaginal atrophy after menopause, sexually transmitted infections, and in men over 50, benign prostatic hyperplasia, an enlarged prostate, and even cancer. Amazingly, the symptoms can be exactly the same, but the origin completely different. And what about a weak urinary stream, having to strain, not reaching the toilet, or even needing to sit down to urinate? That all points to prostate problems, more and more common as you age. If you also feel pressure or pain in your lower pelvis or abdomen, see a doctor. But that's not all. Other organs can also be involved. For example, the intestines. People with severe constipation, diverticulitis, or even appendicitis may urinate more often because of reflux or irritation. Pay close attention to the severe symptoms: abdominal pain, a feeling of heaviness or a mass, unexplained weight loss, blood in your urine, or strange fluids. In people over 50 or smokers, these can indicate a tumor in the uterus, bladder, or intestines. In such cases, act quickly. But what about those who really pee a large volume, not just frequently? The classic example: diabetes. If your blood sugar is high, your body tries to get rid of the excess through urine, so you might produce a lot of urine, feel very thirsty, and have more hunger than normal. The 3 Ps of unbalanced diabetes. Sometimes the diagnosis of diabetes is made just because the patient started peeing a lot more. But there's something rarer: diabetes insipidus. Nothing to do with sugar or insulin. It's an imbalance in the antidiuretic hormone produced in the brain or kidney. This also leads to urinating lots of liters per day, even if you hardly drink any liquids. Another almost movie-like situation: potomania, a psychiatric disorder where the person drinks 10 to 12 liters of water a day. And, of course, they can't stop running to the bathroom. Rare, but real. Now let's open up the topic of the night. Why do you pee so much at night? The famous nocturia. Under normal conditions, more antidiuretic hormone is released at night, so we should be able to sleep peacefully. But if after age 65, 70, or even earlier you find yourself getting up several times, sometimes it's simply because you went to bed with too many drinks in your system. But it can also be from fluid retention in your legs during the day due to poor circulation, venous, or heart failure. When you rest horizontally, those fluids return to your bloodstream, pass through your kidneys, and, you guessed it, you need to pee. Be aware. Because heart failure often first appears as this: peeing a lot at night, and at the same time, shortness of breath, needing to sleep with several pillows, or waking up out of breath. Liver problems, kidney problems, and other disorders may cause similar symptoms. Even sleep apnea, reflux, and obesity generate more nighttime bathroom visits. It may not seem related, but it actually is. Now, what many don't suspect: did you know there are foods that can sabotage you while you sleep? Watermelon, melon, celery, lemon, chocolate, coffee, asparagus, leafy greens. All these can trigger your need to urinate, especially if you eat them in the afternoon or evening. If you notice that any of them are causing more trips to the bathroom, try cutting them off after the afternoon. You might sleep better and avoid the imaginary bladder alarm torture. But as promised, the signs you must recognize to know when to seek help without delay. First of all, if there's no clear reason for peeing more, you haven't increased your liquids. Your diet hasn't changed, you're not taking new medications. It's time to get medical help. If you have associated symptoms: burning, pain, discharge, needing force to urinate, weak stream, blood, weird color, careful, don't ignore it. If you have fever, back pain, suprapubic pain, low blood pressure, feeling weak, and especially if you feel you could be dehydrating, you need to take action. Unexplained weight loss, weakness in the legs, real incontinence instead of just peeing more often are key. And if your life is already being affected, you're not sleeping, you're missing social activities, or your mood has changed, you need professional help. Now, for those eager to know how to improve these symptoms at home, here are my best tips to reduce how often you pee, especially at night. First, cut back on liquids, especially after 8 or 9 p.m. Couldn't be simpler. Second, eliminate or limit coffees, teas, mate, chocolate, and alcohol in the afternoon and evening. Third, if you tend to retain fluids in your legs due to circulation problems, try elevating your legs several times a day or wear compression stockings. This prevents all that fluid from redistributing while you sleep and being eliminated at once at night. A fun fact here, and this is one of the end hacks: before bed, empty your bladder twice. How? Pee, sit down. Yes, even men. Lean forward, wait 30 seconds, and pee again. With this double void, you can get longer and better quality sleep. You can add pelvic floor exercises if you notice weakness or urine leakage. Ask about Kegel techniques or other specific ones with a specialist, and if there's an illness behind it, treatment must go straight to the cause: diabetes, urinary infection, prostatic hyperplasia, vaginal atrophy. Each has its own specific therapy. The most important thing, always, don't try to guess or self-medicate. Consult your doctor and resolve the true origin of the problem. And for those who love to dig deeper, can peeing a lot be dangerous if it's simply your habit? In some cases, yes. Not only because you could be losing electrolytes and dehydrating without noticing, but because there are conditions like diabetes insipidus, kidney or heart diseases that require early solutions before they progress. And I want to leave you with this. Many times, peeing a lot is simply your body's way of telling you something is changing, maybe slowly and silently. Listening to that symptom and asking for help can prevent much bigger problems in the future. Before I go, I want you to remember, peeing more than usual is rarely some meaningless punishment from your body. There are causes and often practical answers that improve your routine and your health. And you, with this freshly unlocked information, have the power to interpret the signs. Take better care of yourself and finally get some rest at night. I encourage you to think. Do you know someone who's been struggling with this problem for years and still hasn't dared to seek help? Share this video. You might make their day and maybe help detect a serious illness early. Tell me, what questions do you still have? What other symptom would you like us to analyze in depth? We read every comment, so leave yours below. Subscribe to the channel now and turn on notifications to know when I publish new content like this. That really helps us continue sharing trustworthy, close-to-home health information. Thank you for staying until the end. If you feel that after seeing this, you have a new key to take care of your health, mission accomplished. See you very soon with more secrets about the human body that no one else tells you, and that can change your quality of life. Until next time.